Today we are releasing another report that essentially shows that our area of the state, Eau Claire metro area, has the highest insurance rates out of any other place in our state. And we're comparing to Madison, which is actually the lowest in the state. We are 22% higher than that region. What that means in terms of numbers for families and for people in our city is that individuals, single people are paying around $1,400 more than an individual in Madison, and a family here is paying $4,100 more than a family in Madison. What we're also focusing on is the fact that the Northwest region is the highest in terms of inflation and has been the highest in terms of inflation since the inflation run-up in 2000. And that's looking at the years basically between 2000 and 2008. This study was conducted. One other thing that is, I think, a major point for us to focus on is the fact that we're higher in Wisconsin than the national average by 30% more, the increase. And what that means is, over this past decade, we have seen 119% increase in the state of Wisconsin. But in Eau Claire, we've seen 134% increase compared to the rest of the state. And, we're looking at these numbers, and part of, I think, the reason that this is happening is obviously the competition that we're seeing in our medical market is driving up costs. The fact that each side decides they need the latest gadget, and those are essentially creating an arms war, but it's on a medical scale. And we're trying to focus on that and also look to Madison and the fact that insurance companies down there are actually in a competing model, which we don't have in our region. And when we look toward the election and toward solutions for healthcare reform at the state level, we need to look toward being able to reward those insurance companies which are actually more efficient. And we talked about that a couple weeks ago. Some of that are able to put 95% of their intake back into medical costs versus some in our region that are taking 25 cents of every premium dollar. Efficiency is not rewarded at this point in the Eau Claire region, and I think that is driving up costs enormously. Now, why does this matter? Obviously, with higher costs, it is affecting our ability to find jobs in this region, our ability to do the things that we want, to have the sort of freedom and take jobs that we want to take. It's also affecting, as the council member here will attest to, the quality of life in our city, our ability to put money toward public services, toward the things that we care about in this great city.
Hi, I'm Joanne, and I'm employed in the city here. Back in 1973, when I was farming, I farmed a dairy farm for 25 years. I had my first child in 75. It cost $500 for the complete hospital stay, giving birth, the well baby check. An office visit at that time was $5. Now, I'm employed. I've gone to college. I'm a paralegal in town. I work for a firm that can't afford to provide really good health care for its employees. For a while I was uninsured because I have a previously existing heart condition. I wasn't able to buy insurance on my own. I was told by insurance agents that I should go work for somebody that had group health because I would never be able to have coverage. Well, I found a job. They have health insurance, but the deductible is so high I still can't afford to go to the doctor. My cardiologist has called me every week saying you have to get in here to be followed, and I can't afford to go. So that's kind of in a nutshell where we are. Small businesses can't afford the insurance premiums. I can't afford to go to the doctor. I was ill and had to go. I finally got all the bills in from that one visit, $792 for this one visit.
I would like to add, as a member of JONA, we've been doing a study on economic justice in Eau Claire, and we've discovered, or in the area, and we've discovered that we have one of the lowest wage scales in anywhere in the state, and with cities of comparable size. So this is so unfair that our health care costs are so extremely high. Thank you.
In the education system, more and more school boards cannot afford to pay all the exorbitant fees that are being charged for health insurance, and more teachers are taking cuts in pay in order to have that be covered. It's affecting economy everywhere, as I think most people know.
My name is Damien. I'm very fortunate. I have Cadillac health coverage, basically equivalent to that what those in the state legislature have. And but I have important people in my life, and I meet people every week who are in just shameful situations because of healthcare cost. And I think costs need to come down, and I think the providers need to pay attention, and I think we the consumers need to pay attention. Just one anecdote, I need a little tube of cream, a topical cream for a skin condition. I'm frugal. I made the last 2 years. I want to just get an order over the phone to approve a new tube of the cream, which works very well. It's not, it's not dangerous or anything. And I have to go in for an appointment. Allegedly, according to the receptionist, federal law requires that the doctor see me. That appointment's going to cost somebody upwards of $200. For a little tube of cream, which will cost me $5 on a copay, but probably should cost about $5 or $2. But it's going to cost taxpayers or somebody, or my health plan, it's going to cost probably, $20, $30, $50. My mother is retired. She's on Medicare. We buy supplemental insurance for her, which is being canceled this year because they're not making enough profit off of it. That's Blue Cross Blue Shield, but they're all, similar profit motive. And so we need to find a new supplemental plan. And I go into the pharmacist, even with her supplemental coverage, and they're trying to charge me $120 for 30 days of Nexium, an antacid. So now we're just trying to straighten that out. Our healthcare system needs reform. We need to keep costs down. We, the consumers, have to pay attention to what we're paying and not just go along like sheep with it. And the providers, including the physicians, the nurses, and the administrators of the healthcare system, and the insurance companies need to pay attention and do the right thing. Thank you.
My name is Barbara Gosh, and I'm very proud to be here today advocating for health care for all Americans. I worked in this field for 8 years, and I see health care as the number one issue facing Americans today. I was interviewed a few weeks ago by someone doing a survey at my doorstep in the economic crash that occurred in the U.S., and she said, "What do you think is the number one issue facing Americans?" And I said, "This may seem odd, but I believe it's health care, because I know that this is an issue you cannot put off. I have seen people come in the hospital who have concussions. I've seen young people who thought they were never going to get hurt break a leg from ski accidents. I know of people who have strokes unexpectedly. The list goes on and on. As far as I see it, if you lose your job, you can maybe go to a food pantry to get food. You can move in with relatives. There may be assistance. But if you lose your health and you are denied health care, to me, this is a domestic criminal act in my mind. I know that sounds probably harsh, but I didn't grow up in the United States believing that if you wanted something bad enough and you worked hard enough for it, that you would be denied. And I know of people here spoke today, that were denied because they had a pre-existing illness. This is wrong. I wouldn't care if I was one person standing in a corner defending people who need health care. This is the number one issue I see facing Americans today.
There's also a referendum on the ballot. Folks, please vote yes on that. That is going to send a strong message to our legislators this coming spring that they need to take action, that the negative attacks, illegal alien attacks, are not going to solve the problem. What is going to solve the problem is action. Thank you for coming today, and keep up the good work.